As an upper cervical chiropractor, I care about the spine, but I care more so about what's inside of the spine. But before I get into that, when I say I'm an upper cervical chiropractor, you may not know exactly what that means. Well, cervical just refers to a part of the spine. We actually have 5 different parts of the spine, and upper is referring to the very uppermost part of our cervical spine. In this area, I care so much about it because it's very unique in both its structure and its function. So from a structural level, there's no interlocking joints. We have joints, interlocking joints going down the rest of our spine, and you can think about those joints like scales on a fish or shingles on a roof. If there's a lot of movement, if there is any movement, it's not a lot of movement, and it's only millimeters of movement. However, when we look at the movement at the base of our skull, there's hundreds of different angles and degrees that can move because there's none of those interlocking joints. There's also no discs at the base of our skull. Again, makes it a very unique structure, which is why I like to focus there because of its unique makeup. From a neurological level, sperm fertilizes the egg. 19 days after that happens, the brainstem forms. And the brainstem controls our heart, our lung, and our colon. Really the 3 most important functions that keep us alive. As things start to grow, from the brainstem grows a brain and a spinal cord, that's your tail. And the brainstem lives just at the base of our skull. And so these wires represent what's inside of the spine. This is that nervous system signal through the spinal cord because nerves think about them like electrical wires. They're transmitting electricity to all those cells, tissues, and organs of the body. So we have nerves exiting the spine on both sides, and they're going to the entire body. So we have signals from the brain through the brainstem to the rest of the body. Now imagine this, if the atlas pulls out of position, and remember, the atlas moves unique to any other vertebra because of its unique structure. So if the atlas pulls out of position, you can imagine all of the dysfunction or those signals that are being compromised from the brain to the rest of the body. That's not normal. Well, how do I know what's going on inside of the spine? I have a gauge. So this instrument I run up the spine, and it's a hypersensitive thermometer taking a temperature reading on the right side compared to the left side. And why is that important? Because these nerves are transmitting electricity. And any time that you resist with electrical flow, a byproduct is heat. Lightning, it comes out of the sky, hits the ground. Fire happens. Same thing in our spine. If the atlas pulls out of position, it's resisting that electrical flow. We're going to have a difference of heat on one side compared to the other. And that's why this instrument is so important because it allows me as your doctor to make the clinical decision, is an adjustment needed or is it not needed? Coming to me every single visit and wanting to have an adjustment is like going to the dentist and saying, hey doc, you think you could drill on my tooth this time and the next time and the next time and the next time? We don't do that. We want to make sure that we have proper dental hygiene. When you come to me, I want to make sure you have proper spinal hygiene and that those nerve signals from the brain through the brainstem to the rest of the body are functioning at their optimal potential. Because physiology exists within a certain range. This instrument allows me to see what that range is and see, is it needed or is it not needed? Because I want to make sure that if it's needed, you're getting an adjustment. If it's not needed, I want to make sure you're not getting an adjustment. It's like overwatering a plant. We only water the plant if the soil's dry. This allows me to check if the soil's dry inside of your spine.